Hello again. Welcome back to Collaborative Program Planning. And in this session, we're going to be discussing using the revised intervention decision matrix. Many of us affectionately call it the RIDM. When we think about planning injury and violence prevention programs, we really are asked to consider several variables. These, as you can see, are on the slide. I'm going to ask you to read them while I talk to you. But some of them are more top of mind, such as cost and people. By people power, I mean, do people with the skills, people with the influence, people with the resources. But if we're really honest, and I want to ask you, which are the factors that really get the most attention? I think it's probably going to fall down to the cost, especially if we're in local settings with resource challenges. And then just, can I get it done? Can I get it done in my grant time? Can I get it done in a sort of compressed frame within which I have funding? And so while they may be practical ways to make decisions, they're not the kind of decisions that we should be making about our injury and violence prevention programs. Now, many of us in injury and violence prevention have a clinical background, but not all of us. But whether or not we do, this is a rule that I really stick to, and that is to first do no harm. We have no business in public health putting interventions in place that have the potential to cause significant harm. And the other thing that we have to pay attention to is the fact that whenever we put an intervention in place, especially when it's policy or environmental change, a product, for example, there is the potential for unintended consequences. Now, sometimes these are positive, they're great, but other times they're not. And it's important for us to make sure that we're not introducing something that has the potential to harm. Here's a familiar and fairly old example of unintended harm that we need to pay attention to. This is the paradox of fear of falling increasing the risk of falling. Say, for example, we know that we have elderly citizens in our community who are falling at an unacceptable rate. We know that we should be modifying the risks within their environment. So doing some product modification or some engineering changes within their home, but we don't have the resources to do that. And so we elect instead to educate the citizens about their risk of injury in the home in the hopes that they will then modify their homes. The problem here is that if they don't, we have people who now have an increased awareness of their fear, of their risk, and therefore increased fear of falling. And so not only were we not successful in preventing their falls by addressing the risk factors, but we may have unintentionally increased their risk for falls and falls-related injury. Clearly, different strategies have different strengths and different weaknesses. And we need to be weighing the pros and cons. And we need to be doing this carefully. But this is a question I get asked more than anything else. And it's how? How do we decide which program options are preferable? Because really, if we're honest again, often it's our preference. And preference is not good enough. Preference is not evidence-informed. We need a strategy to be comparing our possible intervention options. The revised intervention decision matrix has a long history. Andy Dannenberg and I co-designed it back in 1995 when Andy was still at Johns Hopkins. And over the years since he's left, I've revised it many times again, and always with the input of students or community partners as we used it and found that there were ways we could tweak it. But essentially, we designed it to help people compare different intervention candidate options. And I use the word candidate intentionally. If we were hiring for a job, we would hope to have as many candidates as possible so that we had the possibility of identifying the person best qualified for this role within our organization. And the same is true of intervention options. When we consider more than one or two candidate options, we're able to really think objectively about which of these would serve best in this context. Now, we can use RIDM to compare different types of interventions, broadly different types. So an educational option versus a policy option versus, for example, an environmental or product modification. We could also then compare different levels of intervention intensity. So for example, I might consider handing out a free smoke alarm. I might consider handing out a free long life battery smoke alarm with some education. I may do the same thing, handing out that long life smoke alarm with education, and then perhaps following up with the people in the home 3 months later. Very different levels of resource investment, potentially very different levels of results. We could also use it to compare assessment and evaluation options. And this is something that's become increasingly common in the last 5 to 7 years. I've noticed more and more students and colleagues using it for this. So for example, we've decided that we need to do some assessment in our community. And we have options, we have methodological options. Do I do a phone survey or a web survey? Do I do focus groups? Do I do in-person interviews? Who do I use to do those? How long should I be looking at working this assessment? And how sustainable are the findings for this assessment? Similarly, I've had people use it for evaluation options. We have an option, a low resource intense evaluation option, a medium and a high resource intensity evaluation option. And I need to get a sense of which would serve us well in this context. Maybe we don't need the highest cost valuation option, but we can make some objective decisions about that. We can also then identify options that may support each other. So I might be considering policy and education, but I may realize that in fact, efficiently targeted educational options, which increase, say, social and political will, may support my policy. And then finally, we can use it to identify longer term options. Maybe what we know to be the most effective is not feasible now for whatever reason. It could be that we don't have the funds. It could be that we don't have the social or political will, but maybe we can build towards that. So we can increase the social will or increase the resource availability and make something that is more desirable possible for us in future. Here are the elements of the revised intervention decision matrix. They are effectiveness. Is it going to work? Feasibility means, does the technology or the skill or the strategy exist? So it's no, there are ways to get it done. Is it cost feasible? And cost feasibility is worded this way because if it's cost feasible, it's high priority. And we want everything to track on the high, medium, low. We want them all to track in the same direction. How sustainable is it? How ethically acceptable is this option? What's the social will for it? And we've split social will from political will. They used to be combined. But what is the social will for this intervention option? What's the political will? And that could be big P or small p. And then what are the possible unintended consequences? What are the possible benefits? And there may be some that we haven't thought about. And then what's the potential to do no harm? And once again, it's worded this way, thanks to some of my students in public health, because this is the potential to have low risk, but we want it to be high and high priority. So if the potential to do no harm is high, it's something that's desirable. So how do we use it? Well, the first thing is we pick our candidate options, and there could be 3. There are 3 in this matrix, but we could have many more than that. It's entirely up to you. And then we compare each option against the intervention criteria. How effective is option 1? How feasible is option 1? How ethically acceptable is option 1? What's important here is we are not comparing options against each other, because what we could possibly end up with is the least bad choice. And the least bad choice is not good enough if we're going to be implementing it, and there are people at the end of this intervention. So important to discipline ourselves to be ranking them against the decision criteria. We use a high, medium, low ranking, or if you really want to use medium high and medium low to expand your options, feel free. knock yourself out. It's fine. Seriously though, are any of these fatal cells? Is any one of these criteria something that if it's less than high means that that option has to go? It's off the table. What do you think? I'll tell you in a little while, but I'm sure you figured it out. So why do we not use numbers? Every time I teach this, and in the School of Public Health, every year I have people tell me, we decided it works better with numbers. And I have to say, I need to explain to you yet again why it doesn't. The elements are not equally important. So if I were just to decide a high gets a 3, a medium gets a 2, a low gets a 1, we add them all up and then I get a high score and my decision is made for me. That is so clean, it's so easy, and it is so wrong because these criteria are not equally important. For example, ethical acceptability must always be high. If it's not high, you don't consider anything else. We're done. It's off the table. You might say effectiveness is a critical variable, and it would be. Ideally, effectiveness is going to be high. And at times, there may be something that's medium effectiveness, but investing in it now makes sense, either because we can't get to the higher intensity, higher effectiveness one, or because investing in this now, assuming it's low risk, will help us build to something stronger. Now, the other reason we don't weight is that if we were to develop a weighted scale, the weighting is also going to be contextually influenced. So the variables, for example, in one intervention context, the political will may be extremely important. In others, it may not be. Sustainability may be extremely important, but in others, it may not be. There may be a reason why sustainability is not as important for you in this case. And so we have to consider the contextual specificity of what we're doing. And therefore, any weighting system or any sort of scheme that we develop is going to lock us in to a situation that we do not want to be in when we make our decisions about our programs. This is the second question I always get asked. How do we inform our ratings? Well, friends, I hate to break it to you, but your personal opinion doesn't count here. My personal opinion doesn't count here. Nobody's personal opinion counts here. It's evidence. Evidence. What does the literature say? What does the research say? What do your data say? What does your assessment say? What money do you have? What resources have you identified? Maybe in the MSIM, you found resources that make it more cost feasible. But this is not about you just making a subjective decision. And ideally, it's not a decision that one group even makes. It's got to be based on evidence. I know I'm beating you up about this. I apologize, but it's critically important. So let's look at a hypothetical revised intervention decision matrix. You'll notice I haven't even put in the topics because there's lots you can see here without knowing anything about it. So for option 1, they're ranking it medium in effectiveness, highly feasible, it's highly cost feasible. Problem is it's low sustainability, it's a problem. They're saying it's highly acceptable ethically. There's medium political will, high social will. Another challenge is that there are low potential for unintended benefits. All right. High potential to do no harm, that's great. So not many benefits, but potential to do no harm is good. Medium to high, they're rating it. Option 2, it's effective, it's feasible. Cost feasibility, not good. So it's probably something pretty expensive. It's very sustainable. There's some high ethical acceptability around it, very low political will, medium social will. There's a high potential for unintended benefit. The potential to do no harm is, I'm not sure whether they mean that it's high risk or whether they got that wrong. We would probably check that because it doesn't seem to make sense, because why would we rate it as ethically acceptable if we had super high risk? We might want to check that one too, but that was rated as high. Then we see the other one is a solid kind of medium. It's medium effectiveness, feasibility, cost feasibility. It's not sustainable. It's highly acceptable ethically. It's medium political will, social will, medium benefits, medium risk, medium chance of doing no harm. It's a solid medium middle of the road option. So before we move on to look at it in more detail, let's think about how, once we've got a matrix filled in front of us, we could use it. One way we could use it is to check the assumptions we've made in the matrix. So for example, if I've said something is highly effective or that the risk is low, potential for risk is low, you might want to check that. You might want to check that assumption and be sure that I'm correct. We might consider combining interventions to increase effectiveness. So for example, if we find something is very high in social will and something else is lower in social will, we might decide to use whatever we're, for example, say it's an educational strategy that is high social will, we might decide to target an educational approach towards raising social will for the intervention that's more effective. We might, when we've looked at the RIDM, decided, you know, there's nothing here that's looking great. And maybe we want to be considering some other options or other levels of resource, other option intensity here. And then we could do a gap analysis. Is there something here that looks really good, but there are a couple of significant challenges? And what could we do to address those challenges so that moving forward, we might have a chance at implementing the more effective intervention? Now let's come back to the RIDM, and I just threw in a child pedestrian injury example, but it doesn't have to be that. And let's have a look at some pieces of this. So we had three options. One was to educate young pedestrians to try and keep them safe in traffic. The other would be looking at traffic calming to create sort of a safe streets, safe community, safe play environment. And the other would be speed enforcement in high-risk areas, such as around schools or recreational centers. So people have said that educating young pedestrians has medium effectiveness at reducing their risk for pedestrian injury. We have to ask ourselves, is that true? Is there evidence to show that when we educate kids, they are less at risk for being struck as pedestrians, especially young pedestrians? Now, there are some educational strategies that are more effective than others. However, we need to be very clear about whether or not this is effective. And the reason this is important is because if it's not effective, then the potential to do no harm is no longer high. In fact, if something's only moderately effective and we're exposing children to a traffic environment, I don't understand how anybody has rated this as having a high potential to do no harm, because the risks of us being wrong and children being hit by cars is really significant. And if we are basically making our decisions based on the fact that we think it'll work, but we have no evidence that it will work, and we're putting kids at risk because of that, that is flat out not ethically acceptable. So we need to be checking those assumptions. Now let's look at traffic calming. Highly effective, highly feasible. It's not cost feasible. It's going to be expensive. It's very sustainable. It's ethically acceptable, we believe, because it's, in terms of the way we're planning it, low political will for this, medium social will. There are some significant potential benefits, though, of working this way in terms of other community benefits that have nothing to do with injury, may have to do with respiratory health, for example. And then the potential to do no harm, we'd like to think it's high, but there may be people who say, well, I think those traffic bumps, damage my car, whatever that is. Speed enforcement, here's another one. So medium, 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 sustainability is low because our colleagues in law enforcement just can't spend every day of every week and every month enforcing traffic speeding restrictions. We may think it's highly ethically acceptable, but then we have to ask ourselves, is it? What do we know about the enforcement policies in our community? Are enforcement policies equitable? Or have we a history of implicit bias that means that certain people are going to be targeted for enforcement more often than others? Important questions to ask ourselves. So this has obviously raised more questions than it's answered, but I want you to see how we could use RIDM to sort of enhance our thinking about interventions. So, for example, in this case, if we wanted to go after traffic calming at some point, we know that educating pedestrians is not a really viable and desirable intervention in the long term. But we've seen that an educational strategy works at many, many levels. It's feasible, it's cost feasible, there's high social will, there's medium political will. So what we could do is we could then use an educational strategy to try and raise social awareness and social and political will around the issue of calming our environments to keep children and, frankly, other members of the community safe. The good news here is that one of the most modifiable variables in the revised intervention decision matrix is social will. And social will can be targeted and changed, and especially in collaborative work, we may have a good chance of doing that. Now, it's not going to happen tomorrow. It requires persistence, but social will is a modifiable variable. And when we enhance social will, it can also drive the other factors. It may drive political will. It may make cost feasibility become something that we can address. It may also help us become more informed or have people be more accepting of some of our potentially enforcement options, for example. So this may feel complicated to some of you. I know that there are many who like this tool and have used it. But what I'm inviting you to do here is to think that we have our current realities and we have to be as informed and evidence-based as we can as we plan in the present for our injury and violence prevention work. And yet also, while we're planning in the present, to keep our eye on the future, because what is not achievable today in terms of perhaps cost feasibility or social or political will may become more feasible for us in the future if we plan and build that road together.